So today we will be knowing, I know you all know this topic, it is for the limit test of chlorides. So what is a limit test? Let us define what is a limit test. What is a limit test? It is a quantitative or semi-quantitative test. So what is quantitative? What is the difference between quality and quantity? Quality means it is a measure of any of the amount or quality? Quality. Fine. What is quantity? Quantity is weighing some amount? Yes. So that is the difference between qualitative and the quantitative. So limit test is defined as the quantitative or semi-quantitative test. For what? To identify. What to identify? Whether any inorganic compounds or substances are present in the sample. Yes? To identify. After identification, what you will do? We need to control. Control means we need to identify and control the inorganic compound which is present in the sample. So it is defined as quantitative or semi-quantitative test to identify and control what? You will tell now. Control the inorganic substances present in it. Correct. Fine. So what is limit test for chlorides? Suppose in a sample, they are giving you a sample to identify the amount, that is a quantity of chlorides which is present. Which sample can we take? So we can take generally the water. Which water? Distilled water or a tap water? Tap water. Why distilled water cannot be chosen as a sample here? Because it's free from inorganic substances. Saka? Saka? So definition, quantitative or semi-quantitative. Then to identify and control the presence of inorganic compounds. Nestle cylinder, hope you all have seen a Nestle cylinder. Yes? What is it made up of? Glass or plastic? Glass. Anybody can tell me how much ml does it contain? Suppose if I pour a water, how much ml does it contain? 50 ml, very good. It's not of 10 ml? Is there any Nestle cylinder which is present for 10 ml? Have you seen? No, fine. So can you place this Nestle tube holders? What about the base? Talk about the base. It is flattened. So a Nestle's cylinder is a flattened, where generally what all it will contain? Yes? Yes? Inorganic substances like chlorides, sulfates may be present? Yes, may be present. In arsenic may be present? Maybe an arsenic can be present. Iron can be present? Yes, so many of the inorganic substances are present. But are these harmful or good to our body? Since it is harmful, we need to remove these harmful. Modified limit test for chlorides. Have you heard it? Yes? Yes. What is the difference between the limit test of chlorides and the modified test of chlorides is the samples which we use. Generally for the colorless substances, we find out the amount of chlorides which is present in it. Then we are supposed to use the another test which is called as the modified limit test and the modified limit tests. Similarly, we have even for sulfates also modified limit test for sulfates. So, wherever any color substance, how to perform this test? Now, we take the Nessler's cylinder. When we take a Nessler's cylinder,
Ogla. Good morning. Sit. Sit. So today we will study about insulin, correct? So what is insulin? From where it is released? Pancreatic insulin, okay? So from where insulin is released? Pancreas, correct? Pancreas, from which particular thing? Beta cells of beta cell, another is alpha cell. So from beta cell, what it is released? Insulin. Yes, Kavita. Complex form of sugar. We are getting what? Glucose, correct? So here on this cell we are having glucose. So again this glucose is getting converted to what? Glucose 6 phosphate with the help of. So again this glucose 6 phosphate is converted to pyruvic acid. Okay. So where pyruvic acid will form? Okay, glucose is released from beta cells of pancreas. So when in our body glucose is high, at that time insulin is released to reduce blood glucose level. So glycogen is released. When glycogen is released? When glucose levels are less, at that time from alpha cells glucagon is released. Okay. So now carbohydrates. So from the intake of carbohydrates we are getting glucose, correct? So this glucose in the body it is getting converted to glucose 6 phosphate with the help of glucokinase. So inside this cell calcium channel will open, right? So potassium channel will block, calcium channel will open. So again from outside the cell calcium ions will move inside the cell, correct? So after moving inside, so that calcium will stimulate insulin to release. So from inside vesicles your insulin is stored, correct? So from that vesicles insulin is released into blood stream, correct? So whenever insulin comes in bloodstream, it is going to decrease blood glucose level. Clear?
ಆಮೇಲೆ ನಾನು ಕೆಲಸ ಆಕ್ಚುಲಿ 15 ಡೇಸಿಂದ ನಡೀತಾ ಇರೋದು. ಓಕೆ
ಬರೋಕ್ಕೆ ಹೇಳಿ.
Get out. Don't. Asli. Yes. Fix it frame bro.
ಎಕ್ಸಿಟ್ ಫ್ರೇಮ್ ಆಗ್ಯದ.
ನಿನ್ನ ಫೇಸ್ ಕಾಣಿಸ್ತಿಲ್ಲ, ಆ ಹುಡುಗಿದ ಫೇಸ್ ಕಾಣಿಸ್ತಿಲ್ಲ.
ಓಕೆ.
I am Dr. Bhagwan Sai Mangal. I am the Director of the Administrator of Noor Education Trust. We are running the courses B Pharmacy, D Pharmacy, BSc Nursing, MSc Nursing, PCBSc Nursing, GNM and BEd, DEd, MEd and PUC College, Degree College, BCA, BCom, BBM in 2002 in the we are running so many institutions and hospitals in all Karnataka, Bidar, Bangalore, Gulbarga. Aita, I am Dr. Bhagwan Sai Mangal. I am the Director and Administrator of Noor Education Trust. We are running B Pharma and D Pharma course, Greencity College of Pharmacy in 2018 onward. Okay, I am Dr. Bhagwan Sai Mangal. I am Director and Administrator of Noor Education Trust. We are running in Noor Education Trust BSc Nursing, PCBSc Nursing, MSc Nursing and GNM, PUC, Degree and others course and hospital in 2003 onwards.